In this video, we will identify the frequency and distribution of fentanyl-associated deaths in British Columbia using measures of frequency. The number, or count, of fentanyl-associated overdose deaths in British Columbia in 2016 was 325. This condition would be considered at an epidemic level since the incidence of fentanyl-associated deaths has surpassed the expected level based on previous years. Since 2013, British Columbia has reported a drastically increased number of fentanyl-associated deaths, from 12 in 2013 to 90 in 2014 and to 325 fentanyl-associated deaths in 2016. This has clearly become a public health emergency. Not only has the incidence of fentanyl-associated deaths increased in the past 5 years, but also fentanyl-associated deaths have become the most likely cause of overdose. In 2012, fentanyl was attributed to the cause of death for 4% of all overdoses in British Columbia, whereas now, in 2016, fentanyl was responsible for 60% of all overdose deaths. The measure of frequency of this condition can be further analyzed by distribution of person, place, or time characteristics. Person characteristics that may affect the likelihood of an individual to overdose due to fentanyl include age, sex, and socioeconomic factors. Analysis by the Coroners Service in British Columbia stratified fentanyl-associated deaths by sex and age group and found that the incidence in 2012 to 2016 was increased for males and for those aged 19 to 39 years. Specifically, the incidence rate of male fentanyl-detected deaths from 2012 to 2016 was 16 cases per 100 person years, compared to the incidence rate of female fentanyl-detected deaths in 2012 to 2016, which was 4 cases per 100 person years. In comparing age groups, the incidence proportion of fentanyl-detected deaths is increased for those aged 19 to 39 years. The incidence proportion across the lifespan in British Columbia in 2016 is as follows. 1.3 out of 100 fentanyl-associated deaths occur in individuals aged 10 to 18 years. 59.7 out of 100 fentanyl-associated deaths occur in individuals aged 19 to 39 years. And 40.0 out of 100 fentanyl-associated deaths occur in individuals aged over 40 years. The British Columbia Centre for Disease Control reported that the level of opioid consumption, including fentanyl, is 3 times higher in the lowest socioeconomic sector compared to the highest socioeconomic sector. However, no specific statistics were provided. Distribution, according to place, analyzes for variations in measure of frequency based on international, national, and regional geography. Nationally, the count of fentanyl-detected deaths in 2014 across Canadian provinces is as follows. In British Columbia, 90. In Alberta, 61. In Saskatchewan, 9. In Ontario, 176. And in Quebec, 77. Regionally, within British Columbia, the Coroners Service analyzed the incidence of fentanyl-associated deaths by health authority. Fraser Health Authority accounted for the greatest incidence proportion of fentanyl-related deaths with 34.1 out of 100 deaths, followed by Vancouver Coastal Health Authority with 23.6 out of 100 deaths, then Vancouver Island Health Authority with 19.6 out of 100 deaths, Interior Health Authority with 14.8 out of 100 deaths, and finally Northern Health Authority with only 7.8 out of 100 deaths related to fentanyl. The final place characteristic to consider is place of injury. British Columbia Coroners Service identified that the incidence proportion of death due to illicit drug overdose stratified by place is as follows. 61.3 out of 100 deaths due to illicit drug overdose occur in a private residence. 24.2 out of 100 deaths due to illicit drug overdose occur in other residences such as hotels, shelters, etc. 4.6 out of 100 deaths due to illicit drug overdose occur inside public buildings and businesses. And finally, 9.0 out of 100 deaths due to overdose occur outside. Finally, distribution considers how the frequency of the disease or condition changes over time. Data compiled by the British Columbia Coroners Service stratified fentanyl-associated deaths by day, month, and year. Fentanyl-associated deaths in 2014 showed a drastically significant peak in the incidence of fentanyl-detected deaths on Fridays and Saturdays. However, this trend has not persisted. In 2016, there is, however, a statistically significant decrease in the number of fentanyl-associated deaths on Mondays and Tuesdays. When analyzing the deaths due to fentanyl by month in 2016, there is a statistically significant decrease in February and September. However, this is not a consistent trend found throughout previous years. Finally, as mentioned, there has been an increase in the incidence of fentanyl-detected deaths over the past 5 years. A summary on illicit drug overdose deaths in British Columbia found that fentanyl detection in overdose deaths has increased from 5% in 2012 to 15% in 2013, to 25% in 2014, to 32% in 2015, all the way up to 49% of overdose deaths in 2016. Now that we have developed an understanding of the frequency and distribution of fentanyl-associated deaths in British Columbia, let us look at the risk factors, otherwise known as the determinants, for the crisis.